Good morning, everybody. Oh my goodness. Let me back up off that. I'm so sorry, I didn't mean to push y'all's here. That scared me a little bit. I hope that everybody is having a wonderful Friday morning. And hopefully after this, you guys are going to have a very long 4th of July weekend, maybe? Or at least get a Monday to go with a Tuesday. So we're going to go ahead and get started. So Deenee Shipman is here today. And she's going to talk to you guys about not as prescribed, the effects of medication misuse. So Deenee Shipman is a registered nurse with more than 20 years of experience. She received her associate's degree in nursing from Wilkes Community College and has worked in multiple specialty areas including medical, surgical, geriatrics, including Alzheimer's disease and dementia, dialysis, diabetes education, and hospice. Deenee joined Vaya's geriatric team in 2016 and enjoys connecting with others and informing individuals about mental wellness and how medications and other forms of treatment can be helpful in managing care. So I'm going to let Ms. Deenee take it from here.
Thank you. Wow, I don't usually get applause. As far as find a place to sit my water here. So I'm a registered nurse and a certified dementia practitioner. And I work with the Vaya geriatric and adult mental health specialty team. Our focus is educating caregivers in whatever form that may be in the community and in facilities. And we are an interdisciplinary team. I have one of my team members here today, Felicia Wood. And she is a qualified mental health professional. We also have I think you've heard Amy speak before, our licensed marriage and family therapist on our team. But it works out pretty good for us to be an interdisciplinary team because we can kind of put our heads together sometimes and solve some problems. And I attend the Alexander Substance Use Coalition in Alexander County, so I know somewhat about the purpose of these meetings, and it's good to see so many members of the community come together. This is a difficult problem, isn't it? So today we are going to be talking about some medications that might cause some problems, especially in the elderly, but in anyone in general that they misuse them, and we know that opioids have, had a big spotlight in our focus on trying to help individuals that have substance use. But there's some other things that can cause some problems too if they're not used properly, so we'll talk about those today. I know we have different people from the community, so I see law enforcement. Do we have county government here? I know we don't have time for everybody to introduce themselves.
City government.
City? Okay. What about medical professionals? Awesome. So, and I'm sure there's quite a few more categories of people here from different venues. So, I'll stay a little while afterwards if y'all have questions. Or if you want to say something during this presentation, it is informal. I welcome those comments. Sometimes people have things to add that help other people understand things. Afterwards, I do have a couple handouts that I brought with me. One is called Adverse Drug Events from Specific Medications. Those of you that are medical professionals, that might be a little bit more interested in that. And then I do have a fact sheet that I printed from the CDC on how and when to use naloxone for an opioid overdose, and kind of answers some frequently asked questions. So we'll have those available for you afterwards if y'all are interested in those handouts. So I just want to go ahead. I feel like I need to adjust something here. Does this come off?
Yes.
Okay. Maybe that might work better. So I can see my PowerPoint thing here. All right, so we'll get started. Feel free to get up, eat, and whatever you need to do. Like I say, this is informal. I will also have certificates available for a contact hour of education for those of y'all that can use those for your disciplines. And Felicia will be happy to fill those out for you if you'll just let her know your name. Felicia's over here at this table. Felicia, raise your hand again. That's who you'll see for a certificate if you want one afterwards. But you do need to stay at least 50 minutes for us to be able to bring your certificate. We always have a disclaimer. This is not meant to be behavioral health advice as far as trying to get someone to change their plan of care. It is just meant to be educational and informational and just to help along the way. Sometimes people come across ideas or words that they want to research later, so sometimes it stimulates some conversation. Our foundational concepts are what we base our presentations on, and it's kind of like a mantra for us. We talk about stigma in all of our trainings. Those of y'all that work with these individuals know that they get stigmatized if they have mental health issues and substance use issues. And, they fight against that, and sometimes it keeps them from reaching out for the care that they need. So we try to reduce that by educating ourselves and making ourselves available because we do know that that happens in the world. Also, a lot of individuals who have substance use problems or are experiencing those problems have trauma in their life, a high percentage. So we need to be aware as we care for people that they may have experienced trauma in their life. So trauma is what they say it is. All of us probably have been exposed to some kind of trauma in our life, but it's kind of like pain. If it's experienced by them and it feels like trauma to them, then it is trauma. And then person-centered care, we want to make sure that we work on the goals that the individual wants to work on and not just go in with our set of ideas. And I think by sitting here in this room, that is important to each individual that's in here, or you wouldn't be spending your time trying to help someone else and trying to find out how to help them and how best to be a help to them. So that's just really important with mental health care and substance use care, because a lot of times, they've alienated family and things like that, and they need somebody that cares about helping them and, who they are as a person. So our objectives today are to identify at least 2 contributors associated with medication misuse and polypharmacy, increase the awareness of these classes of medications that can negatively affect the functioning, and talk about 2 ways to reduce medication misuse and polypharmacy. So it is a growing problem. We have a lot of our population that is aging now, so the percentage of the population that is going to be 60 or 65 years of age or older is really increasing and is expected to get even higher in the next 10 to 15 years. And I know even at the federal level, they're trying to change legislation to make states more age-friendly. North Carolina just went through that. Roy Cooper just passed an initiative and trying to make North Carolina a more age-friendly state. And we focus a lot on geriatrics because there's a lot of people who need assistance in that area. So who can maybe give a guess as to why medication misuse might be a little more problematic in the older individuals?
Confusion.
I'm sorry?
Confusion.
Yes. They might not understand how they're supposed to take their medicine. But as a physical standpoint, what might be an actual reason to? Pain. A lot of pain. As we get older, we have more chronic problems, arthritis and pain and other things that cause pain. So, yeah. I'm not sure what happened. So, also, if you think about our bodies as we get older, we also, our liver and our kidneys slow down a little bit. So, we're not, expelling out medication as quickly. So, as far as through our kidneys, and that's usually how medications come back out of the body. And so, things can build up. A lot of older individuals tend to be on a blood pressure medication, several different medications for other things too. And each time you add a medication in, you can have a risk of interaction between medications. So what exactly is misuse? Does anybody want to take a guess?
They're not following the directions properly.
Yeah. It could be, maybe they're supposed to take the medication at night and they don't realize it and they're taking it in the morning and it's causing them to be dizzy or, have some problems. I know a lot of times when people start on a medication for dementia, there's some things that medication can cause a little bit of stomach upset and it can cause some dizziness and stuff. So they tend to start those medications at night so that the person kind of sleeps through that first few hours, and then by the time they wake up, then the most of those side effects have kind of dissipated. So is there side effects to every medication? Yeah, even if you think about baby aspirin, if you take too much of it, or your level gets too high, then you can have bleeding or some stomach irritation. So all medications tend to have some side effects, and then of course if you add more into the mix, then you're going to have more problems. What about taking more or less than prescribed? If you're on a blood pressure medication and you don't take it every day, it may not be effective. Also, taking medication that's not prescribed for you. I've had an older individual offer me a blood pressure pill. Here, I've got some extra here. Would you like one? And they're trying to be helpful. I was visiting my friend and her mother overheard our conversation, and I said, I forgot to take my fluid pill today. And she was like, well, I've got some. What kind do you take? And so she was trying to be very helpful. But, sometimes they just don't think that the big problem with that, if you give somebody a medication, it doesn't go through the process of the doctor prescribing it in addition to what else you're taking. So the doctor has to look at that, to look at your medications to see what you're on. The pharmacist also runs that through to make sure there's not any drug interactions. So if you skip those two processes, not to mention the person might be allergic to something. If you give somebody an antibiotic or something and they're allergic to penicillin, and what you have is a form of penicillin, then You know, that could be a really bad situation. So, people do that sometimes, trying to be helpful, you know, taking medication or giving someone else medication that's not intended for them. Also, this lady over here mentioned confusion, misunderstanding, how the drug regimen is supposed to be, or misunderstanding the reason that it's prescribed. My husband, he took a medication one time that he thought was a blood pressure medication, and it was actually a pill that his doctor had given him a while back for itching, because he had had a rash, he had had an allergic reaction. So he kept coming home every day, and he was like, I just am so tired. And he was like, I've been taking that other blood pressure medication. I'm like, because he said it was like a bluish green pill, and I'm like, I don't know what you're talking about. And it was Vistaril, and it was making him sleepy, and he was taking it going to work, and he was like, all day long. I was like, you're going to kill yourself. You know, I'm a nurse, but he doesn't even ask me about. He just, and I was like, he took one time we went to Merle Fest. Anybody heard of Merle Fest?
Oh, yeah.
So we live in Wells County, so we went, you know, off and on for a lot of years. And he plays music, so he loves to go. And it's expensive to get in, so I'll just tell you this story. It's expensive to get in, so we usually work the festival so we don't have to pay those $70 and $80 tickets to get in. And so we get worked up at the front gate, checking people's packages, you know, and all their coolers to make sure they don't have beer or glass or anything. And so we went to sit down, and he was like, you got to bring stuff with you to Merle Fest. You can't go back to your car. I mean, you can, but it is a pain, because you have to ride a bus to get in there. So you bring everything with you. Well, he had took a ibuprofen bottle and put some Tylenol, there was already ibuprofen in it, and then some other strange blue pill. And he said, do you want some Aleve? And he takes this bottle out and he hands me some Aleve, what he thought was Aleve. And I was like, that's not Aleve. That's not the shape of Aleve. What is this? It's generic Aleve. And I was like, no, I'm not taking that. I don't know what that is. So I took some ibuprofen, and we sat down, and a little bit later, he took 2 of the blue pills.
Oh, Lord.
So I look over, and we're listening to Preservation Hall Jazz Band from New Orleans. I don't know if y'all ever heard them. They're awesome. But they have all these trombones and tubas, and I mean, it is loud, and it's awesome. And I look over, and he's going,
Oh, wow.
he kept dozing off, and I'm like, what is wrong with you? Are you okay? And he was like, I'm just really tired. And so we finally end up leaving because he cannot stay awake, and I'm concerned something's wrong with him. So we get home, and there's a bottle on the counter. And I open that bottle and look in it, there's those blue pills. So I'm looking on the bottle, it was ibuprofen, generic ibuprofen PM.
Oh, wow.
And he had took 2 of them. So that's just kind of a funny story that happened to us. But you know, that could be bad. If someone was taking that and driving or just misunderstanding, you gotta look on the bottle and you gotta read it. So he does read, you can read. He just assumes. Okay. All right, let's go back and try it again. Thank you. I'm sorry, I was in my story, I didn't pay attention. So, yeah, don't take something unless you know what it is. So, all these things can pose problems, and Also going back to, somebody want to guess what the prescribing cascade is?
Going to different doctors and getting more.
Can be. One doctor's not aware of what the other one is prescribed. It also pertains to when you start a medication, and this can be over the counter too, doesn't have to be something the doctor has prescribed. And within a couple or 3 weeks, you get some kind of side effect. You might not associate it with that medication because you've already been taking it for 2 or 3 weeks. An example would be starting to take over-the-counter Benadryl for your seasonal allergies and not mentioning it to the doctor because you don't think about it. But in a couple weeks, constipation comes on because Benadryl kind of dries your system out. And some people it causes constipation. So then the person goes to the doctor and gets put on medication for constipation. Whereas if there was a discussion about some kind of change, the doctor might have picked up on, well, you know, it could be the Benadryl. Maybe you can increase your fiber, increase your water intake, or whatever. But a lot of times people get on more medications to treat the side effects of medications they are already on. So then there becomes a lot of medications in the mix that really don't necessarily need to be there. I recommend that you have a conversation with your doctor every year when you have your physical and see if there's any medications that you might can come off of. Because the less you take, the less chance of interacting or side effects that you're going to have. So, you know, the more strong a medication, the more possible side effects you might have, and you might get started on another medication for those side effects. So we want to try to prevent that as much as possible because of those interactions that can happen. So we talked a little bit about this already, the risk of medication misuse, especially in the older adult. There can be cognitive changes. Blood levels of medications can increase because we're not flushing that out of the body as quickly. And delirium can even happen if things build up to a certain point. What is delirium? I know our medical people know that. Delirium is where someone is confused. It comes on quickly. It is not dementia, although it looks like it. But dementia develops very slowly over time. So the person might be confused on where they are, why they're there, who they are. And it looks really scary, but usually it's a medical problem that can be treated. Good, that's a good thing. But if you have an older individual in your life and they all of a sudden are starting to be confused, they might have a urinary tract infection, or it could be a medication problem, you know, something building up. So that's good to know. But those are some things that can happen if we don't make sure that their medications are not interacting with each other. So I'm not going to spend a whole lot of time on the aging process because I know that y'all are more focused on just medication misuse in general. But as we get older, we do lose some muscle mass, our liver structure and function changes as well as our kidney function, and some digestive changes happen. Some people have slower digestion, so it takes longer for medication to get in the system, and then it takes longer for medication to get out of the system. So if they're used to taking something that helps their pain, and it usually helps within 30 minutes, and then as they get older, it takes longer, they might end up taking more medications, thinking, well, this is not working, maybe I need 2 of them instead of 1. And they may make that decision, and that can be bad if it's an opioid. And then, of course, we have some changes in brain structure and function as we get older also. So these can all contribute to problems in the older adult with medications building up. Some commonly used medications that can cause cognitive changes are benzodiazepines, and I'm going to name some off for you in just a minute. The opioids, of course, the opiates, and then anticholinergics, over-the-counter, Benadryl, things like that. And we'll talk about those in just a minute too, and how they can cause a problem. So the benzodiazepines, we're getting away from using those as much, but especially mixed with alcohol. A lot of people aren't aware that if they take these medications and alcohol along with it, then that can cause some serious, serious problems. We're getting away from prescribing these as much, but you have a lot of people that are still on them as needed, even as they get older. There's mixed studies, there's some studies that say these medications have a high risk of causing problems with and dementia. And then there are some studies that say that that's inconclusive, they're not sure. But a lot of times these are also given, and the person might have an opioid too that they're taking, and if you mix those two together, you've got the risk of decreased breathing, and it can actually cause someone to stop breathing if they take those together, if it's a high enough amount. So we have to educate our individuals that are on these medications for anxiety, and even sleeping. You've got temazepam or Restoril in there too. That's in that same category. So these medications are being used less in the elderly, but we do need to educate, make sure they're aware not to take them with alcohol or the opiates at the same time. Opioids, of course, y'all have heard a lot about those, I'm sure, in your meetings here. They're becoming a bigger and bigger and bigger problem, aren't they? And a lot of doctors have cut back on prescribing these as much to individuals, but what's happening is people are turning to other things. Even in the older population, we're seeing more heroin use, to try to get that pain relief. And a lot of people aren't aware that Ultram, which most people feel like is just a little bit stronger than Tylenol, it actually is an opioid also. It's a milder opioid, but it is an opioid also. So these combined with the benzodiazepines or alcohol, which is really readily accessible for anyone, are just a big problem with misuse in an older individual. And a lot of people, these get misused because people take them to sleep sometimes. As we get older, we have more problems with sleeping or staying asleep. So a lot of times they'll take their pain medicine knowing that it's going to make them sleep, and then they're taking it more often than they should be because they're taking it for pain and they're taking it to help them sleep. So that's how they get misused a lot of times. Does anybody have another comment on this, on how they get misused? Maybe unintentionally in younger or older people?
We see a lot of times that they forgot whether they took it or not, so they'll take another one just
Yeah.
to make sure that they
Yeah, that is true. She was saying that some of them might forget that they've taken it or can't remember if they have or not, so they may take another one just to make sure that they don't hurt or have the desired effect that they want from it. People also they don't realize, I think, sometimes the effect that it's having on them, where other people that are with them might see that more clearly. It kind of, blunts their ability to assess, maybe their ability to drive. Or I know that, officers, you probably run into people that are on prescription medication, but they're not realizing the effect that it's having on their body so much until they're in an accident, and then, maybe they go to sleep or something and have an accident. They're not trying to drive, crazy or anything, but then they're not realizing the effect that it actually does have on their body, I think, sometimes. Because I've heard of, we have a coworker. Yeah.
Also, a lot of them that are on opiates, they have a tolerance buildup. So if
Yes.
the doctor is telling them to take one every 8 hours, they may feel like, it's not working, and they take it upon themselves to take more without consulting with the doctor.
Yeah. What are some signs that we can see that they're doing that? They may call and say, I need more medication.
Yeah.
And they say, well, you taking it like you're supposed to? Yeah, but I've just run out. So, or they may say, they may come up with excuses, well, I dropped some of them, so I don't have as many, You start seeing all those signs of misuse. So, yeah. But she had a good point there. The tolerance, that's part of the addiction cycle. And that's another thing too, doctors are wanting to cut down on the people that are getting addicted to these medications. But there are truly people who have a lot of pain and need medication. So, it's a fine line there. Because sometimes they cut back so much that some people were turning to other things to get the relief that they needed. So, in the older adult, we just want to talk about some risks. The addiction, it could cause more falls or accidents or vehicle accidents, causes more cognitive impairment. So if the person has a little bit of cognitive impairment, this can increase it, more confusion. It can lead to delirium if there's a buildup in the body. And they're saying that these medications, opioids, also can contribute to the beginning of dementia in some form. And then we talked about those anticholinergic medications, which are like Flexeril. A lot of your PM medications have Benadryl added to them to make people sleepy. And Benadryl is really hard on older adults. That's that cholinergic pathway. And what we do know is the hippocampus is really sensitive to drops in acetylcholine. So if you drop it by medications even more, it's just not, a lot of doctors won't allow their older patients to even take Benadryl in any form. But a lot of people don't think much about taking a Tylenol PM or taking some ZQL or something, to help them sleep, and they get that over the counter. But it's just not recommended in older adults. And it doesn't mix well with alcohol either. So these are some of the examples of the anticholinergic medications. So that could actually affect memory. It's affecting the cholinergic pathway in the brain. Also another one is gabapentin. This is being prescribed more and more and more for a lot of different things. It's actually a medication for seizures, but it's being prescribed for diabetic neuropathy or any kind of neuropathy. It's actually being used for restless leg syndrome, even insomnia. And so that can cause a lot of problems too. Oh, I figured out if I could just go back out and back in. We're figuring this out, aren't we? Okay.
I have a question about gabapentin.
Okay.
What most people tell me is it helps with their nerve pain. So if it's originally made to treat seizures, is there proof that it does help with nerve pain as well?
Yes.
Okay.
Yeah, it really does. And, a doctor can prescribe a medication off-label. They're allowed to do that. And a lot of them do for nerve pain. That's just kind of been a standard over the last few years. But gabapentin affects your neurotransmitters in your brain. Some people hate it and can't take it. They're like, I cannot take that stuff. And some people, it really, really helps them. And we're all different with our DNA. And how we process medication in our body goes back to what our DNA is sensitive to. So, it's going to be different for different people. So some people get a lot of relief from that. It actually it kind of numbs those nerve receptors in a certain way, but I've heard that it's not really all that good for the nerves. So, it's a catch-22 there. It's hard. You've got a lot of pain to deal with it. It's hard to, it's going back to that weighing the risk and the benefits. So, but it does scare me that it's being prescribed a whole lot more. And so, each time we're adding in medications, we're adding in the possibility of side effects. And doctors can, people can get on pretty high concentrated dosages of this. They go anywhere from like 100 milligrams. Some people are taking, 1,200 milligrams a day, so that's quite a bit more. So you want to take the least that you can. Now, I'm not recommending people come off of this if they're taking it. You've got to talk to your doctor because that may be the best thing to help your pain. So I'm just saying that, it can become a problem in an older adult if they're not tolerating it well. It also has been given to help with pain with shingles a lot of times. And it actually can be used in cancer treatment to help with hot flashes. So they're giving it for more and more things. But, and I think a lot of people don't think much about it because it's prescribed so much, but it can cause some problems. So, some other medications that are of particular concern with older adults is antipsychotic medications. A lot of times these are given in small doses to those individuals who have dementia and start having some behavior problems, and they've tried other things. This is one of the reasons I think our team is so important, because we teach other ways to deal with behavior problems in dementia. And sometimes we're causing the problem, not meaning to. But if we're not interacting with them like we should, then they're going to get frustrated, and then they're going to be more likely to, have some behaviors that come out of dementia. So antipsychotics have a black box warning, which means that they can cause death in an older individual that has dementia. You will still see them prescribed, but they're not recommended for older adults unless it's just absolutely necessary. Antipsychotics in an older individual can cause, I tried my trick, but it didn't work. They can cause heart rhythm problems and cause the heart to stop. So, and, you know, that's why they use it in very small doses with older individuals. Those are medications like Abilify, Haldol, Zyprexa, Geodon, things like that. And they're giving those more for different problems too. So we just want to make sure that in the older individual that I can get it to come. So taking medications directly exactly as they're prescribed is a helpful hint. Making directions, especially for someone who doesn't see well or, you know, has vision problems, making sure that they print the label on the bottle bigger. You can ask the pharmacy to print it for a person who has vision, you know, needs a bigger print. So they can see it better and they can make sure what they're taking. A lot of people, a lot of older individuals that have to take several medications, they know what color and what shape their medication is. But have you ever got medication from the pharmacy and it looks different than what you got the last time? This happened with my husband the other day. He got Lasix and this one's like a little long, elongated shape. And I was like, let me have that. I'm gonna look that up. So if you Google, you can Google anything. So if you Google white oblong pill, and it had 16 on it, so I put in the 16, and you Google that, it'll tell you what it is. Or some people have an app where you just take a picture of it, and they'll tell you what it is. But you can look up any medication, unless it's off the streets. Can't guarantee that, but any medication, and it will tell you if you put the shape, the color, and what numbers or letters are on it, it will tell you what it is. So I looked it up and it was Lasix, but you know, they get these medications sometimes from a different source, and it looks different if it's generic because it might be a different color. Always check those out. If something's different looking, you know, and you're getting it from the same pharmacy, then check it out or ask the pharmacist to make sure that that's what it is. Because, you know, people make mistakes, so that can happen too. Monitor medications that make sure they're taken accurately in adults with memory issues. If you have to, some pharmacies will put them in a little bubble for each morning and each night. So then all of their pills are in one bubble, and it says Monday and Tuesday. So that's very helpful. And if they miss it, then you can go back and look, ooh, that one's got missed. So that's good. Or you can do that yourself in those medication boxes, you know, the little things that pop up. You can get those pretty cheap at Walgreens or somewhere. And, you know, fix their medications for them so that they don't get confused. When I was doing home health and hospice, you would not even believe how many people were taking their medication wrong when I would go in. We actually helped a man who was taking his medication all wrong, and he had heart problems. And when we came in a few months, he was doing like 100% better, and we took him off of hospice. He got mad at us because we was helping him with a lot of other stuff too, some social issues that he had, and, you know, helping him get some resources and some stuff he needed. And we had to step back out of the picture because he was doing so much better. And it was because he was misunderstanding and taking his heart medication all wrong. So it happens a lot, you know, if people don't have the support that they need, like family support or people coming in and checking. Get clarification if instructions appear unclear. Contact the prescriber immediately if there's unusual side effects. And don't stop any medication without first speaking to your prescriber. unless you have an allergic reaction to it and you can't breathe and gotta go to the hospital, then you need to let the doctor know, I had an allergic reaction to that. And if it's an antibiotic, you might need to get you a different one. You need to take a list of all current medications and supplements to the doctor, even the over-the-counter stuff you're taking. Know why you're being prescribed each of those medications. Ask if there's any potential negative interactions with other medications that you're taking. You can also do this at drugs.com. You can plug in your medications and it will print you a list of possible interactions with your medications. So that's good to know. And familiarize yourself with side effects so that you can pick up on it if you're starting to have one a week or two down the road. And then advocate for yourself and for your family. So we talked about some contributors associated with medication misuse and polypharmacy in older adults, some classes of medication that can negatively affect an older adult's functioning, and also some ways that medication misuse and polypharmacy can be reduced if possible. There's a couple other, I've got this handout for y'all if any of y'all are interested. This one's called Adverse Effects, Drug Events from Specific Medicines. And it also mentions blood thinning medications, because a lot of people end up in the ER because of problems from their anticoagulants. They may have bleeding from their stomach, or maybe vomiting up blood, or having a lot of bruising, or things like that. So that's another medication that you really got to make sure that the person gets tested if they need their blood drawn every so often. Make sure that's getting done, because that can really have some adverse reactions. Something else I wanted to mention in here. Does anybody have any questions so far, or anything to comment? Yes.
I hate that we're not getting to see the slides, because I know you have a really great presentation. Are you willing to share those slides with us? So that we
Yes.
can send them out to our
Yes.
folks if they
I can send them to
Okay,
y'all.
that'd be great. Thank you.
I sure can.
One thing I mentioned is, I talked about the patients having a med list. That's really important, especially now in pharmacy. You mentioned pharmacies to be like a pharmaceutical pathway between meds from different providers or mail order.
Exactly.
Causing people to get their meds from some from mail order, some from community pharmacy. So community pharmacy may not know what you're getting from mail order. So it's really important that the patient advocate themselves have that med list.
Yes.
Share with the provider and their community pharmacy as well. Because nobody knows the entire picture unless that patient has that list.
Yes, and bringing the supplements and over-the-counter stuff too. Yeah. He mentioned a good point. He said a lot of people are getting their medications through mail order. So if it's not going through your local pharmacy where you're getting some of your medications, then they're not aware that you're on them unless you provide that to the doctor and share. He can share that with the pharmacist. So they're getting better about that since we have so much technology. But yeah, it's very important you advocate for yourself when you go to the doctor, and make sure that they're aware of everything that you're on, so that he doesn't prescribe something that's going to interact with something else. Because that can be a real problem in some of these medications. I was thinking there was something else. I think it's mostly talking about anticoagulants there. Insulin, of course, you have to be aware that insulin can cause a lot of problems if the person, maybe the person doesn't feel well that day, they've got a virus or something, they go ahead and take their insulin, but they're not eating hardly anything, sometimes people end up with emergency calls because of that. Their sugar drops really, really low. So that's something to notify the doctor about. If you have a virus, a stomach virus, and you're not able to keep anything down, you might want to call the doctor's office and say, what do I need to do? I might need a little bit of insulin, but I'm scared to take the whole dose that I normally take. So, educating your family about being aware of that too. Because that is one of the things that really gets treated a lot in older adults, with EMS and hospital visits. Well, if y'all don't have any more questions or comments, those are really good comments that y'all have had today. I appreciate your time and thank you for having us here. I'm sorry there's been so much problems with my computer thing here or whatever's going on, but appreciate y'all being patient with that. So if those of y'all that want a certificate, see us and we'll get that for you today, and we thank you. If you will, just fill out your evaluation, and we will be sending these slides out, which have a lot of references and resources on them at the end, because I can't show that now, but we'll send those out to you that's interested in that. So thank you.
So yes, becoming a common BSAN. So we're going to see if we can get moved to that one next time to make sure we don't have any of these issues. So does anybody have any other questions for her at all? Yes, they'll send us the PowerPoint and I'll send it out to everyone on the BSAN list. And I know Brandy mentioned, but some people have come in after. If you'll sign in on the sheets that are in the middle of the table, we put you on the BSAN list by your email. So if you're getting emails from us and you don't want to be on that list, you can tell me. But I put you on that list by your email, and that's how you know what the next BSAN is going to be, because I'll send out those flyers as we create them. So if nobody has any questions for her, we're going to move on to Haley. She's going to present the Officer Award for this month, and she's with the LEAD program, which is the Law Enforcement Assisted Diversion, if you guys don't know what that is. I'm going to hold this thing.
You can just stick it in there.
Okay, so this month's a little different, because it's not from Morganton Public Safety. Once a month, I meet with the people all over the county, and we go through all of our overdoses and referrals that we have. And this month, it is Deputy Abernathy, and the Savannah, which is the Administrator of Narcotics, is going to receive his award because he's on vacation.
Thanks for having me here. It's the first time here. Beautiful building. I hope to catch the next meeting as well. Like Haley was saying, we usually try and get together once a month and discuss overdoses within the county and what's being found most, and we'll see if there's a recurring problem, which we obviously know there is. But Deputy Abernathy is he's a wonderful man, and I would say that he goes on probably half of the overdoses that is responded to within the county. I would say that the only face I know in here is Davey Anderson from Long Beach, but probably know Johnny pretty good.
Oh, yeah.
But I wish he was here to get this because he's a good one, so I'll definitely pass it along, and hopefully we can get him at the next meeting for sure. So, thank you, guys.
Do you want a picture for him?
Yeah, you may.
And for the departments, if you guys have anybody that you guys just want to, recognize as Officer of the Month, they do get fancy cool baskets. That is the 4th of July one. They get $50 just for being Officer of the Month, so.
Who doesn't like that?
So this is weird, y'all don't have to look at us.
Well, I figured you would want one and we won't put it on BSAN. I have lost Brandy, so I'm pretty sure she does not know that this BSAN meeting is ending, and I don't know where she wants to go from here. I will say there's a lot of new faces. It is only 9 o'clock, and, I mean, it is the 4th of July weekend coming up, so I know you guys want to get out early, but would you mind if I pass the microphone around and you just tell your name and what agency you're with? In case anybody in the room wants to connect with you, if they need a resource that is available. Are y'all okay with that? Yep, I'm gonna start with Miss Julie Walker.